One of the most common conditions that we see in an ENT's office is chronic sinusitis. The most common reason is you have more than 3 months of symptoms such as nasal obstruction, meaning you can't breathe through your nose, it feels blocked or congested. If you have yellow or green drainage, or even it's cloudy or white for more than 3 months in a row, as well as a loss of smell or any type of facial pain or pressure, will end up meaning that you might have chronic sinusitis. Chronic sinusitis is an infection of the sinuses, which are cavities that line the skull. They become infected, they're blocked, the mucus in it can't get out, and the bacteria grows, and you have this chronic pressure in your face. You can't breathe because your inside of your nose is swollen, and you get lots of this mucus coming out. And sometimes, because it's so congested, you can't smell anymore. When you come to an ENT's office for this, we're going to do a very comprehensive workup to see what's going on, to try to treat you medically at all times. And then if that doesn't work, we talk about surgical options. When you come to an ENT's office, such as mine, and you have all these symptoms I talked about with chronic nasal congestion, yellow-green drainage, facial pain and pressure, one of the first things we're going to do is a physical exam. We're also going to talk to you about how long this has been going on for, what kind of symptoms do you have you been on antibiotics for this or not, and have you had any scans of your sinuses. One of the other things we look at is, do you have any issues with allergies, chronic nasal congestion outside of that? When you come to the office, often we will do a scope in your nose. So for that, I would spray your nose with a slightly bad tasting spray to numb it, look with a rigid scope in the nose in order to visualize where the sinus is drained to see if there's any mucus or pus draining that I can culture, meaning I put a small swab in the nose, swipe the mucus, and send it to the lab to see if there's a bacteria growing that I can treat with a specific antibiotic. We also look for polyps, which are benign growths coming out of the nose that can often block the opening to the sinuses and make you have more infections. After we do the scope, often we'll talk about a long course of antibiotics and what we call maximum medical management, meaning we want to treat you as best we can with medicine first before even talking about anything surgical. Would be 3 weeks of an antibiotic, often directed by that swab and culture that we did. We will add a nose spray, such as a topical steroid spray, which shrinks the nose and gives less inflammation and makes more likely for the sinuses to drain better. Sometimes you'll get a steroid by mouth, and we'll also really want you to do saline washes where you do the flush in your nose with the saline rinse to get all of the mucus out of there. If this fails and the antibiotics don't treat your condition, you're not doing well, when you come back, we'll get a CT scan of your sinuses, which is a more complicated x-ray to look inside the sinuses. I can see with a scope where they drain, but I can't see into them unless you've already had surgery. And the CT scanner that we have in our offices has some very low radiation dose, so it's a lot safer to do than a bigger CT scanner that you often had before. After we do the CT scan, I can go over it with you in the office right then and there to show you what the sinuses look like, where they're obstructed and inflamed, what the infection looks like. If after all of this and possibly talking about allergy testing and some lab work to check your immune system, if you're not doing better, the next step would be a surgical option to open the sinuses to get them to drain, which goes from a balloon sinuplasty, which can often be done in the office, whereby I numb the nose, I look with that scope that I used before, which is a small rigid glass scope, and look into the sinuses and pass a wire into the sinus and a balloon over that to dilate and open it. Most people tolerate this very well in the office, and that can allow the sinuses to drain to get rid of the infection. If you have a very serious infection in that all the sinuses are involved, or you have polyps in your nose, often you'll need a bigger surgery where we would go to the operating room and use the same scope to look into your nose and open the sinuses to get them to drain by taking down some small bones at the opening of the sinuses or opening up all the sinuses themselves. That way, the sinuses drain better. The topical rinses that we use can often have antibiotics to get in there to get it to clear, and it will, over time, cause your sinuses to go back to a more normal condition so they're not infected as much. If you have polyps in your nose, this is a chronic, we call inflammatory state. Kind of like asthma as inflammation of the lungs, polyps are kind of like inflammation of the sinuses, where you're always going to be on some type of topical steroid spray to keep them from coming back. Sometimes you need more medication for that, and we work hand in hand with our allergists sometimes for it. Most people tolerate these surgeries very well, and for an added layer of safety, almost all of the sinus surgeries we do that are more complicated, we take the disc from your CT scan and put it in a special machine that allows me to navigate, meaning that where I am in your sinuses shows up on the CT scan, so I know exactly where I am, because we're working near your eyes and near the brain. So we want to make sure that we're safe at all times and have your best interests with that. Most people recover from sinus surgery within a week to 2 weeks. Balloon sinuplasty, when it's done in the office, you can go back to regular activities within several days and more strenuous activities within a week. For a true sinus surgery, then you need to see me back at 1 to 2 weeks out to clean out the sinuses with a scope in the office, because if there's any blood or crusting in the sinus cavity, it can scar and compromise and make your outcome not as good as it could be. After about 2 weeks from a formal sinus surgery, you're back to normal activity. You can usually go back to work at about a week with that. The other reason that you might want to come to see an ENT and have your sinuses evaluated, or that you might be a candidate for sinus surgery if you have more than 4 sinus infections per year, we call it recurrent acute sinusitis, where you may not have symptoms that last for 3 months, but if you have more than 4 sinus infections a year, there could be something going on, whether it be allergies, something with your immune system, or something to do with your anatomy that makes you have more sinus infections that will need to be evaluated with a scope and a CT scan as well.